Welcome to NextGen Healthcare, proudly presented by Optimal Telehealth. Are soaring health insurance costs for your family or business causing you stress? Tired of the long waits and high fees for a simple doctor's consultation? Then you found your podcast. NextGen Healthcare is here to empower you to take back control over your healthcare decisions, freeing you from the constraints set by insurance companies. In our episodes, you'll uncover the secrets to circumventing traditional insurance to access direct services from your preferred providers at savings of 40 to 50%. This podcast is a creation of Larry Stout, the visionary founder and CEO of Optimal Telehealth. Now, let's hear from Larry.
Hello, and a big thanks to our followers. Hope you're finding our content informative. Pardon me. In our last episode, we interviewed Wayne Orchard, who's an executive vice president and a partner in Lyric Health, who is our virtual healthcare provider. We traced telemedicine back to its origins and brought it forward through an evolutionary period where it's become a consumer product, and ultimately we talked about the evolution into virtual healthcare, which is a whole bundle of services. So if you missed that, feel free to go back and look at it. I think you'll find it interesting. Today's episode, we're identifying some of the reasons healthcare has become so expensive. It is a massive topic, and there's a lot to cover, but we're just going to touch on the high points. Increasing healthcare costs really fall in. I mean, the way we're going to look at it today kind of falls into two categories. There's the costs that you expect. I mean, there's inflationary costs. The price of Band-Aids went up. The price of labor went up. Everything's gone up. So there's those. There's no use us talking about that because there's not much we can do about it. We want to touch on some of the things that can be managed and should be managed, but perhaps aren't. So let's dive into that. First, let's take a look at the big picture. And if you've seen my previous episodes, you've seen me or you heard me talk about this a number of times. I could quote this statistic that the insurance industry, the health insurance industry, actually inflates the cost of healthcare services by 80 to 100%. And the government is on top of this. And in 2020, they came out with the Transparency in Healthcare Act, and it was turned into, it was first just a rule, and then it became legislation. But it requires medical service providers to disclose both cash pricing and insurance pricing, so people can tell the difference. And obviously the difference is stark. It's dramatic. Some of these prices, some of these problems we're going to talk about today actually originate within the healthcare industry, but the insurance industry has the ability to regulate some of these things. So we're going to talk about why they don't. Let's first visit the statistics. According to the Bureau of Labor Statistics, the value of $1 in 1993 is the same as $2.18 in 2023. That's an inflation rate of 118.45%. But during that same period of time, medical services costing $1,000 in 1993 would cost $2,726.23 in 2023. That's an inflation rate of 172.6%. So obviously you might anticipate as a layperson, not really knowing what's going on, you might anticipate that, improvements in medical technology, the hospital organizations coming together and consolidating, and all the efficiencies that are built into our system would control inflation a little bit better, but that hasn't been the case. Medical costs have increased substantially higher at a substantially higher rate than consumer products. So what did begin happening in the 1990s was an increased focus by the insurance industry, the health insurance industry, on profits. They saw this. They could foresee what was coming on in the marketplace. Again, all the technology increases, how medicine was becoming a big business, a big industry. And they really had to, for their own survival, they had to focus on stockholder return on investment, on profits. So again, this is something we've discussed in the past, but the matter of fact is, since the 1990s, they have continued to increase their costs, and that's how we eventually evolved into what is called high deductible insurance, which is the products we see today. The first big, huge impact on the cost of insurance came with the Affordable Care Act, Obamacare. The Affordable Care Act was passed in 2010, and multiple sources will tell you that essentially it doubled the price of health insurance. And it did that because the one mandate that they required of the insurance, the most significant mandate required of the insurance companies, was that they not consider pre-existing medical conditions when they price their policies to the consumers. So in the past, where healthy people would have a lower insurance premium rate, unhealthy people that didn't take care of themselves or just had health problems had a higher rate. Now it was all equal. I mean, they can look at your age and the size of your family and all that, but they can't look at your past medical history. So that leveled the playing field, and it caused claims expense for the insurance companies to go up significantly. And of course, insurance companies have to make money. They're not going to absorb that. So they pass that right along to the consumers in the way of increased rates. Those increased costs pushed premiums up. So the government had to step in to make it affordable. That was part of the whole Affordable Care Act thing, to make it affordable for people depending on their household income. The government began to subsidize those premiums. Let's say that we've got a family here and their insurance is now $1,500 a month is their premium. The government steps in and says, based on your income, your family household income, we're going to subsidize that to the tune of $750 a month. So you only have to pay $750 and we'll pay $750. Well, that sounds pretty good. You know, that makes it affordable, and millions of people got on board with that. But consider what really happened here. There's a couple of problems with that. First of all, you're paying, you have reached a level where you're paying a monthly premium that the government considers affordable. But once you get that policy, and let's say it's a silver middle of the road average policy, you're going to have a $5,000 annual deductible. You're going to have a 30% co-insurance rate. And if you just have one major medical situation, event in your family, you're going to be up to the policy maximum of neighborhood of $18,000, $1,500 before you know it. That's why medical bills are the number one cause of bankruptcy in America today. I mean, the average person that's in a situation like that, where they're getting their insurance through the exchange, and most people get it through their employers. That's kind of a different conversation. When you're getting it through the exchange and it's being subsidized, you don't have the $5,000, let alone the $18,500. So we've still got problems. Another consideration is the $800 subsidy or $750 subsidy the government provides. You think, well, that's good. Okay, the government's paying that for me. Well, where does the government get that money? They get it from the taxpayer, or they borrow it from China or whatever. It increases our national debt is what it is. So the insurance company gets their money. They're going to wind up getting the whole $1,500. And you get a reduced rate insurance coverage, which you need. But at the end of the day, consumers pay for it. So that's part of what causes the debt structure in America today and the deficit, and causes our cost of living to go up. Ramsey Solutions, which is a publication of Dave Ramsey, which everybody knows is a popular figure, suggests that consumers would, with these increased rates, consumers might just ditch their health insurance plan And he says that is a non-negotiable part of your financial safety net. Do not get rid of your insurance. So Dave Ramsey says, many people listen to him, says you've got to have insurance. And whether you listen to Dave Ramsey or not, that's a popular mindset. We're so used to health insurance, we think there's no other options. But of course, that's what this podcast is about. Next generation healthcare is an extremely viable option. And hopefully when we get through this episode, this presentation, you'll be a little bit smarter and know a little bit more about how to make those decisions. Okay, let's jump over to another subject. Now, this is something that medical providers do. Hospitals are bad about it, but doctors' offices do it too. It's called upcoding. It happens all the time. It is a common practice. And what that involves is you go in to see a doctor, you go into the hospital for something, and the doctor's going to come in and see you, and he's going to check you out, check your heart or whatever, and he's going to look at what his nurses have done, some blood pressure tests and weight and all that, and then he goes on his way. He diagnoses it or gives you a prescription or whatever. But then the hospital or the doctor's office takes that particular, it's all done with coding. There's a coding system around it, and that's why they call it upcoding. So they take that doctor's office visit, which might have cost $1,000, or say a hospital visit, which might have cost $1,000 when you're going through the emergency room or something, and they upcode it so it's $5,000. They could just easily take a $5,000 visit and upcode it to $50,000. They could say, well, the doctor came in and looked at you, and he did this extensive treatment. He did something that made it worth $50,000. He worked on you, okay? It's not unlike charging $50 for a box of Kleenex, $35 for an aspirin. We've all heard those stories where you'd look at a hospital bill and you just paid $35 to get an aspirin. So what happens why doesn't the insurance industry regulate that? Why don't they crack down on that? Well, I'll tell you why. There's a reason. There's a good reason. Insurance companies are restricted to claiming a certain portion or taking a certain portion of any insurance claim as profits. And of course, they want to cover their expenses, administrative expenses, et cetera, and take profits. They can only take a certain percentage of that claim to accomplish that. So if you turn in a $5,000 claim, if a hospital turns in a $5,000 claim, they get a certain percentage. But if they upcode that to a $50,000 claim, the insurance company puts a lot more money in their pocket, as does the hospital, okay? So they kind of let that stuff slide. Medicare and Medicaid is a little better about regulating that stuff because the government's got some people that keep an eye on that. It's not a perfect situation, but they watch it a little closer. We've all heard of Medicare, Medicaid fraud, but that's the reason. Everybody's making money on this, so why should we complain about upcoding? That means that it's kind of up to the consumer, the patient, to keep an eye open for this. And in a previous episode, we interviewed Crystal Paulson, who is a patient advocate, and she talks about uncovering these kind of problems. You simply get an itemized bill from the hospital or the medical provider, and they're required to they'll typically provide a summary bill, but if you ask them for an itemized bill, they will provide it. They have to provide it. They've got it. That's how they keep up with their pricing. So they give them an itemized bill, and you can look and see if you paid $35 for an aspirin. It's right there on the bill. Insurance administrative costs. Here's our next subject. There is such a huge overhead in administration with health insurance in the United States. It can be as much as 30% of the claim, and that is easily twice as much as the administrative costs in other developed nations, European nations, etc. It's just substantially out of control, and a lot of that has to do with the back and forth. If you've read the articles that I've seen where recently I saw an article where Cigna Health Plan was automatically what they call machine rejecting. No human person looked at the claim. They just got these claims turned in electronically, and the machine in seconds rejects the claim for random reasons. And that what they're doing is just keeping that money in suspense. Back in the old days, I remember when before credit cards became the whole thing. When you went on a vacation, you took traveler's checks with you. And of course, you get traveler's checks for next to nothing. American Express had them, etc. Why were they so cheap? Because American Express is setting on that money. You get $5,000 worth of traveler's checks, and they get to set on that money where you're traveling around the country, dealing them out a little bit at a time. Well, that's what happens in this situation. If they can keep those claims turning back and forth, and they go back to the doctor's office or hospital and they're resubmitted with different coding on them, they're just keeping that money in suspense. And when you take that times thousands, tens of thousands, millions of people and claims, that's a lot of money that's earning interest for them in their dividends. So now let's take on another subject. I'm going to call it multiple systems. And it really boils down to the fact that the U.S. healthcare system is really complex. You've got separate rules, separate funding, enrollment dates, out-of-pocket costs associated with various forms of health insurance, whether it's employer-based, private insurance, government-provided, Medicaid, Medicare. For providers, this means dealing with a myriad of regulations about usage, coding, billing. These activities make up the largest share of administrative costs. I spoke previously about it being up to 30% and so high, and this is part of that process. So it is an extremely complex system. I've said numerous times, I always said when I'm talking to people that nobody ever understands insurance until they have a baby. A woman told me that one time, and I think it's pretty accurate. But nobody understands how insurance works. It's a complex process, and I think it's by design. Here's another one. Let's move on to drug costs, and this is something I'm not even going to try to address. We could make a whole episode on this in the future, but we see in the media about our politicians saying they're going to jump on this whole cost of drugs situation. I personally, from my personal experience, I'm on Medicare, but I've been prescribed drugs that were fairly new and name brand, and they're very expensive. Even on Medicare, I had to pay a lot of money for them. And I have gone out of country. I've gone through Canadian pharmacies. I've obtained these drugs from other countries, Israel and Turkey. There's perfectly quality manufacturers over there manufacturing those exact same drugs under license from the original American creator of those drugs. And you can get them for a lot less. And also, you will find on the world market that they have generic drugs for those brand drugs. They come out with the generic drugs much quicker than the United States. In other words, a particular drug, I may not have a generic available in the United States, but I can go to the international market and find a generic that works just fine. So we'll cover that in the future. Next subject, profit-driven, what I call profit-driven hospitals. The hospital industry is huge. If you just reflect on it a little bit, darn good and well around your own community or city where you live, you've seen hospital systems just absorbed. Like I know in Dallas where I'm based, the Baylor Hospital System has absorbed many of the peripheral hospital organizations around the city. This is a big business, and these guys are pulling this all together so they get control of it. And they've got stockholders. I mean, whenever you purchase a business like that for, millions, hundreds of millions of dollars, you've got to service that debt and the interest associated with it and still make a profit. So there's certainly economies of scale by these big organizations consolidating together, but at the same time, it's all about making a profit, turning a profit. Another contributor, and this has been around a long time. You know about this, what I call defensive medical practices. That's when you go into your doctor's office, and I let me back up a little bit. I have, as I go out and present to consumers, to employees of businesses I work with, present to them that they can actually get their healthcare services or primary healthcare services over the telephone or video conference. It's very common for somebody to say, but when I go into the doctor's office, I mean, they check my heart rate, they check my temperature, they weigh me, they do all this stuff. And, if I'm at home, they can't do that. Well, in today's world, you can, but the fact is a lot of the stuff that doctor does when you walk in is just just to cover his own liability. He wants to make sure you're healthy. He wants to take advantage of you being in there to give you good value for the call, for coming in for the appointment. But at the same time, it's common for doctors to run medical tests and stuff just to make sure they don't expose themselves to lawsuits and liability. So they might do an EKG or run you through a stress test or something, not because you have symptoms that justify that, but because they just want to make sure you're okay. And again, I'll use myself as an example. I clearly remember when I became a certain age, my dad passed away of a heart attack at 57. So I have a history of heart disease in my family. And so when I got around that age, my doctor just automatically sent me out for a stress test. I didn't need a stress test. I was perfectly healthy. But he sent me out that year, and next year when I did my exam, he sent me out again. And the second time he sent me out, I'll never forget the cardiologist. When I went in to get the test, the cardiologist looked at my chart and said, "Why are you here?" I mean, why did your doctor send you here? And it was very telling. So that's a good example of what I'm speaking about when I say defensive medical practices. And finally, as we get towards closing this episode, let me talk a little bit about the insurance industry's overreach. I'm going to call it overreach. Maybe that's not a good term. In February of this year, 2024, the Department of Justice announced they were investigating United Healthcare for violations of Antitrust Act. Now, these antitrust laws have been around a long time. We kind of hear about it on the news, don't pay much attention to it, but the fact is United Healthcare was running the largest private health insurer in the U.S., a sizable physician network, a major billing and data and analytics business, and one of the largest pharmacy benefit managers in the country. That's kind of putting your arms around the whole pie, That's the last huge antitrust breakup, and I know they're going after Google right now, trying to break off their browser. But there's that just now coming back. The largest antitrust breakup I recall is years and years ago when AT&T was broken up, Southwestern Bell actually. But that's why those laws exist, to keep these major corporations from taking all of the piece of the pie under their control. In October of this year, I mean, just a couple of months ago, 2 months ago, a month before last, Blue Cross and Blue Shield agreed to pay $2.8 billion, that's with a B, settlement in an antitrust case. That case has been ongoing for over 2 years, and finally, Blue Cross just said, "Hey, just to bring this to an end, we're going to pay you $2.8 billion. So was there something there to be concerned about? There certainly was. They wouldn't be paying $2.8 billion to get out from under that whole situation. That is a gigantic hit in the pocketbook for any corporation. I don't care how big they are. So in conclusion, our objective today was to increase your understanding and awareness of some of the factors that impact the cost of your health care. Hopefully, this increased knowledge you can make, with this increased knowledge, you can make smarter decisions in managing your healthcare services.
Thank you for tuning in to Next Generation Healthcare, brought to you by Optimal Telehealth. Your engagement means the world to us. If you find our content informative, follow our podcasts on Apple, Spotify, or YouTube. We welcome your participation and will review listener input in future episodes. To leave your questions or comments, access additional episodes, or browse our blog post library, please visit the resources page at optimaltelehealth.com. You may also connect with us on LinkedIn, Facebook, or Instagram for the latest insights and updates. We look forward to welcoming you back soon. Your journey towards empowered healthcare continues with us.